Sarah Lawley, Operational Nurse Manager of the Integrated Critical Care Unit. With the ITU at capacity and demand still rising, we had to quickly find a solution to increase the number of beds available to enable more patients to receive urgent care. To help to resolve this, we turned to our doctors and our consultants. I'm here with Mr. Andy Garnham, a vascular consultant, to see why he decided to train as an intensive care nurse and how it went. So Andy, how many consultants and doctors have been asked to train as ITU nurses?
So I'm Andy Garnham, I'm a consultant vascular and general surgeon, and it was around 150 of my colleagues as consultants and some of our registrars who've been asked to come and train to help out on the ITU. And I think you do us a kindness to say train as ITU nurses, because what you do is far different from our day job. We have trained and you've put some training in for us, and perhaps we'll explore that.
So you say you had this training. What did it involve and what was that like?
So we had a couple of components. There was some face-to-face to start with, but really because of the volume of people, your training team put in some online training, which was very good, and I guess kind of quite detailed really, and some of it was a lot more than I thought might be expected of us, but of course there's some on-the-job training, and the nurses on the ITU have been extremely good at supporting those of us who have gone up there to actually do the training in person in a supportive on-the-job type training.
You say some of that training was unexpected. You didn't think you'd have to know that. Can I, just out of interest, ask what that is?
A lot of the sort of detailed stuff around looking after the syringe drivers, the ventilators, some of the quite technical things, which is quite difficult to get over in a video lecture, but actually when you go up to the unit and you explore actually the practicalities of doing it, it's perhaps much easier to learn when you're up there.
Yeah. And how did it feel, going to train to be an ITU nurse after so long as a consultant? And I don't mean to insult you on the length.
No, well, I think it's quite daunting to do something completely new, and it's unfamiliar. But I think as you go up there, you realise that actually there's quite a lot of crossover in what we do. There's quite a lot of things that we all understand, like taking observations, recording them on charts, measuring urine output, drawing up and giving drugs. So you do that whether you're a doctor or a nurse. But then there's those machines that one is slightly unnerved by, like the ventilator and all the syringe drivers, because although I prescribe lots of things, I don't necessarily give them.
So you describe a little bit about what you did do, but do you want to elaborate a little bit more on what you found you enjoyed, what you didn't enjoy? How was it?
I think I very much enjoyed going up to the unit and the team working environment, because it's really nice to be working with a close-knit team and the support. And I know that the other members of the team who are more experienced there were reliant on those of us who were coming up to help to do some of the jobs that we actually do day to day, which helped them deliver some of their particular ITU skills to more of the patients, because we were working in groups of 4 with 1 or 2 experienced ITU nurses. It released their ability to do some of the technical things that they're experienced around. And of course, I think all of us who've been up there have learnt new skills and have more confidence in managing some of the areas that we wouldn't have managed before, like managing lines, ventilators, CPAP.
So, have you had any other reaction from the staff? Have they fed back to you, and patients especially? Were you able to interact with those?
So the patients are quite difficult because a lot of them are ventilated. I mean, there's a few that are not on a ventilator or on CPAP who can interact, but mostly these people are so sick they're on a ventilator. So slightly different from my usual environment, but the staff, it's been a humbling experience to see how grateful they are, having been doing this, I guess, since last March, and they've been enormously pressurised. And I think their reaction to people going up there just to help has been absolutely wonderful. They have been nothing but supportive about people going up there. And I think sometimes they haven't necessarily had the time they would like to put in to helping us with some of the more expert things because of the pressures.
I know from feedback from myself, they're truly humbled by having consultant medical presence up there. I think it's been an enormous benefit for everybody moving forward with relationships and just feeling that support as well. What sort of change was it for you mentally, physically and emotionally?
I think, as a vascular surgeon, I'm quite used to managing quite sick people. And I think for me, I guess that's not such a big leap. I think for some of the other members of consultant staff and other nursing staff, I think, who've come from more outpatient-based areas, that's more difficult. But I think what really strikes me is the sheer volume of really sick people who are quite young, who are in extremely difficult positions, and that's something that I think I'm not used to, and I think that is emotionally difficult to process, and I think that's going to require a lot of support going forward with people who have been doing it. And I think that's a challenge for us in the organisation going forward.
How has it made you feel regarding your own job and compared to an ITU nurse in terms of how you regard them? I think you've mentioned some of that.
Oh, I think, doing 12-hour shifts continuously is something that has really, their level of stamina to do that, I think is really impressive, because I have to say I do night call, and sometimes I'm called out to do operations in the night, and sometimes they're long operations, but it's not consistent 12-hour night shifts or day shifts for that matter. But I think it was the night shifts that got me.